Okay, so this is the HSC Healthcare Center where we all do our internship at. So if you want to follow me, come on in and I'll give you guys a tour. Okay, so patients will park in the parking lot, of course, and they come in through here. And then this is the patient waiting area. And so of course they will sign in up at the front desk and then take a seat until their name is called. And so once their name is called, they will come through this door on in. And first, what normally happens at each patient visit, their height and weight will be recorded over on this scale over here. And then they will take them to one of the 5 rooms that we have. And here is just an example. This is what basically all the rooms look like. So the patient will of course have a seat. The blood pressure will be taken, same with looking in the ears, nose, throat, and then the doctor will come in and evaluate the patient. So then if the patient does need medication or anything at the end of their visit, they will then go to the doctor will then pick up medication for them at the med cart.
Alright, so this is the med cart. This is where the doctors come to get any medication that is needed for the patient, any antibacterials, antivirals. To open it, they just push this to the side and then pull underneath. And then in here, there's a bunch of different medications sorted accordingly. They're all sorted based on alphabetical order. Alright, follow me. We have a few different other exam rooms. So exam room 3 is one of our bigger exam rooms. This one we use for procedures such as cyst removal, ingrown toenail removals, any of that cool stuff. As we go on, this is the lab. So the lab is where we do any blood draws. So the patient will sit here and get their blood drawn. We can test different things like cholesterol, HbA1c, lots of different things with the blood stuff. So this can test your cholesterol and that can test your HbA1c. And then we have a centrifuge, so any blood that goes in little vials like this, we can mix it up in one of these. Alright, if we go on, we can see a few more patient exam rooms. So these doors that we're walking by are different doctors, nurse practitioner offices. So this is another one of the bigger exam rooms. This one can also be used for procedures, but is not as often. So as we go back around here, right here, this door leads to a storage room for any medication. It's normally always locked, so we can't really see in it right now. But when the med cart needs refilled or anything, they get the meds from here. So this one is the break room for the doctors and any medical assistant. Anyone that's really working here, they can, on their break, go ahead and go back there, make themselves some food, anything really, just for fun. Alright, so this is the Young at Heart Pharmacy. So all the meds that patients need to come pick up are going to be right here. As you can see, there are a lot of unpicked up meds. This is also the storage room for the HSC Healthcare Clinic. So right here are any braces, anything that the patient may need. We also have some walking shoes and some walking boots back here. There's also storage for stuff to stock the room with, like Kleenexes or surgical scrubs, hand sanitizer, anything like that. Alright, as we walk back this way, this will be right back to where we started. So if you come back here, you see all the other patient rooms, the lab's right to that side, and that concludes our tour.
So now we're going to interview Amanda, who works with Young at Heart. What is Young at Heart and who can use it?
Young at Heart is a long-term care pharmacy. We supply medications to nursing homes and then certain clinics like HSC Clinic.
What does it cost each patient?
Each patient works for the Hamilton School District at the HSC Clinic, and they can get all generic medications through us for free.
So what's your normal daily routine at the clinic?
I get here from 2 to 6, and patients can come in, pick up their medications, and then I can also call them, let them know their medications are in, and then I also stock the med cart at night and order inventory.
At the HSC Healthcare Center, we see a lot of illnesses and conditions on a daily basis. We'd like to share our most recurring and our most complicated illnesses and conditions with you.
Bronchitis is a condition that occurs when the bronchial tubes fill with mucus in the lungs. The first symptom of bronchitis is dry cough that occurs as the mucus shrinks the air passageways. This causes a shortness of breath and leads to wheezing as air can't reach the ends of the lungs. Causes of bronchitis is smoking that kills off the cilia that fight off the excess mucus, and illnesses that hurt the immune system. The big difference between bacterial and viral infections are the treatments. For bacterial infections, antibiotics work well, while they do not work at all against viruses. For viruses, you can get vaccination of a weakened virus to help the immune system get used to the virus. The body creates antibodies to fight off the virus. Some examples of bacterial infections are strep throat, tuberculosis, and urinary tract infections, while some examples of viruses is the common cold, AIDS, and chickenpox.
Sinusitis can take many forms, including bacterial, viral, and fungal infections. Patients often come into the clinic complaining of lots of sinus pain. This pain is primarily in their forehead and down through their nose into their cheekbones. Sinusitis occurs when the nasal cavities become swollen and inflamed, causing pain. The treatment method varies on what type of infection the patient might have. So viral is going to be treated differently than bacterial, and so on and so forth. Patients will occasionally come in with sebaceous cysts at the HSC Healthcare Center. Someone with a sebaceous cyst might complain of unusual bumps on the skin or some type of pain ranging from uncomfortable to a painful level. Cysts are caused when the sebaceous gland is blocked or damaged, or there may be other trauma. There's a complex treatment for sebaceous cysts. Microsurgery is performed, damaging the cyst sac, removing it, and patching up the area. There are a few tests that are regularly conducted at the clinic. These would include a urine dip and a strep throat test. Urine dips are most commonly conducted with CDL or DOT physicals. The physicians want to ensure that bus drivers are healthy enough to be driving. The urine dip checks for abnormalities, as does the strep throat test. The strep throat test uses a system of lines and fluids to indicate whether the patient is positive or negative for strep throat. This is only a rapid test, and it may not indicate whether the patient truthfully has strep throat. Further cultures are generally required to verify the results of the rapid test.
Alright, so